Good evening, colleagues, and I'm proud to present the results of work of communication analysis team as a corresponding author. And now let's go to the paper, the mental health discourse in social media as a factor of information resistance of Ukrainians. Let's outline the situation, the context. In the first year of Russia's full-scale invasion of Ukraine, the war became a powerful news break for updating knowledge about human psychological states. This study is based on a sample of posts in social media and that have highest audience engagement coverage written from February 24th of 2022 to February 24th, 2023. We applied the discourse analysis to determine the patterns of people's discussions about mental health. Study results show that during the first year of the war, the Ukrainian society went through 3 periods of awareness of psychological states, from confusion about the situation to establishing interpersonal communication and for mutual assistance and understanding the war in the context of common social values. The perception of situation by Ukrainians was interpreted according to 3 levels of framing: personal, interpersonal, and general. To outline how the discourse of mental health and social media contributes to the production of collective knowledge necessary to increase society resilience in the face of war. Yeah, we want to say that discourse of mental health can show how collective knowledge established organically in social media. The key questions of the study is how social media reflects changes in the attitude of Ukrainians towards taking care of their mental health. In particular, we will focus on the following specific aspects. What are the most common messages about personal mental health? Who are the key communicators of the mental health discourse? And what are the intentions of the posts and the motives for dissemination of this post? What are the peculiarities of the discussions? Tone, gender, specificity, the geography of posts and conversation specific, and how does the war frame the discourse of mental health? We outline quite wide theoretical frame, but we base on critical discourse analysis, classical critical discourse analysis, but we go to in some terms to political studies. We use narrative and event analysis because we see war as a big event that involved people to the discussion. Mediatization studies we use to understand media logic and social media logic. We use instruments of frame analysis, psychology, integral theory, and we use approach of mixed method analysis. To conduct the study, a sample of public posts was formed, which were published by personal profiles on Facebook, Instagram, YouTube, Telegram, Contact, and TikTok, written, as I said, from the first year of the full-scale invasion. It collected by a USCAN commercial monitoring system, only posts, not comments or reposts with geolocation Ukraine and not determined will consider it. Total sample of 2.8 million posts was randomized and coding was started until we had obtained 1,200 relevant posts, those containing meaningful statements about psychological problems. Approximately every second message from the original set was relevant, thus 0.12% of messages were analyzed, and thus the sampling error was not exceed 3%. Manual coding was conducted with the involvement of 4 coders. Disagreements between coders were resolved through a discussion on a joint online chat. The following categories were identified: type of post, description of condition, description of visit, etc. The main symptoms, diagnosis of author in the post, or about him or relatives, the main symptoms that people generally write about, personal judgments about mental health, and in addition, for more the post, the system automatically identified the demographic characteristic of social media users, such as gender and region of residence. Based on the quantitative analysis of the data, discourse analysis was conducted to identify topics and frames and to describe patterns of communication on the topic. We applied the message analysis and frame analysis, as I said. So what the topics, what the news break for starting discussions about mental health during the war? What was the problems? We outlined 14 topics that was mostly discussed in a big frame of war: threat to life, loss of property, leaving home, forced migration, the loss of relatives, separation on the front line, mental health understanding on the front line people, the collapse of life plans, occupation, a feeling of uncertainty, life in a frontline city, disability, illness during the war, difficult relationship in the family, difficulties, restriction of access to education, pregnancy, childbirth, captivity. Figure 1 shows the percentage of this topic of discussion, this news breaks. Yeah, and let's go to more detail, other details. Gender distribution of attention goes to the women. The women mostly discuss mental health in a discourse, and it is understandable. Statistics show that these are women. Women traditionally take care of children and elderly relatives, so they are talking not only about themselves but others. And yeah, there was some post about how female soldiers feel themselves at the front line, but there was mostly exceptions than a rule. Men also share opinions about their state, but traditionally men talk about their state less than women, and they are more criticized when they are talking about their mental health and about some problems of health. Especially in this situation, in situation of war, they were more criticized because if they are not a soldiers, if they are going abroad or something like that. Soldiers was mentioned like our guys, they receive more empathetic comments expressing gratitude and respect. Especially from women. Men are more likely to advise if women are more diverse in their expression of mental health situation, men are more likely to advise relieving stress with alcohol or share their experience. I drink once a week steadily and I like a lot, but not strong. Yeah. But it was not only the topic that men discussed, for sure. A regional distribution of attention to the topic of mental health. So we see that their discussion were mostly took by Kiev and the region, and understanding reading what people saying, we can say that they are more informed about mental health problem and how to understand them. These people from this region. For Eastern region, it is typical to express reflection on changes, mostly in the psyche. They fixed changes because of the war. They use more metaphors, euphemisms, so more like it shows like more mythological understanding of life. The central and northern parts of Ukraine represents many questions and advices on how to overcome stress. They mentioned this word stress. They made suggestions ranging from food to fitness, services for children who have moved to the hubs. It means that this region has more people who practiced active form of life. Posts from the west part of Ukraine contain more information about services from organization, not from people, but from organization, treatments, advices, and events to bring people together. It's understandable as well because west part of Ukraine became like a big hub for people who moved, and they were mostly talked to each other, and more seeable posts were from organization. And south part accounts for experience of the war and gratitude to Alexei Arestovich. It is more like Alexei Arestovich in that time was advisor of office of the president, and he prevent in some way the panic, and he supported people as they now still recall it, with quiet, soothing voice, giving expectation for the future, like war will be ended like 2-3 weeks. In 2-3 weeks, it was the case of psychological support, not from psychologists. And also mentioned PTSD quite too much on the south, much more than other regions. What the topics we had? It was like general consideration, some reflection on what is happening, how to behave, some suggestions, some application for how to live with this, but it mostly general, based on previous experience of psychological support or some psychological situation. Mental health advices from professional or like social media experts, people who are not only experienced the situation, but people who have the expert information how to deal with these states. Description of your conditions, like personal feelings from themselves. People share the feeling from first saying. Description of the situation of vulnerability. Post-war described situation defined as war as that situation that affect change in mental stage, and description of experience of visiting specialists. So people share this experience to show that psychologists could help or specialists could help. Authors were ordinary consumers, support group organizers, activists, individual experts, and those who spoke on behalf of organization providing some services. So we see that people has not only information about psychological states, but there was actors that can provide much more information. Actors who were active and who bring information step by step, making this discourse more grounded on this topic. And in the discussion, we can see that state is extremely dependent on the overall situation of the war. And this diagram shows the dynamic of optimistic, pessimistic, and neutral sentiments of accepting the situation that we see in the meaningful posts. And we can divide outline three periods of understanding what happens. First period is confusedness about what happens, and we see high level of pessimism and less level of optimism. But we see that this optimism is grown up till July, summer, when people were accepted the situation and started to think more about how to deal with the situation, how to adopt the situation, so to say. And we see that trend of optimistic emotion is not, it growing up further. And the second period is till the big victory was happened in this. In that year, it was the deliberation of Kherson. It was big victory for people, and this event frames moods and frames frames how people talk about their mental health as well. But in this period, the second period, we see that people share practices, they share knowledge about how to deal with situation, and they mostly more and more connected to each other, gather each other, invited each other to some events to help with the situation. So if in first period we saw much more posts about personal state, how I feel, what I see, and not reflection about how to deal with it. The second period, it is about how to act in this situation. Yeah, and how to get the knowledge about how to prevent some worse situation, worse states. But after the Kherson, we have third period, and this period is about growing up pessimism in connection with such an event like New Year. People used to think on New Year Eve about what happens this year, what we gathered, what the results. And actually it framed perception of reality mostly to pessimism. Because there was quite not good results that we had in that New Year Eve. But we see that then tendencies to growing up of optimism were beginning with the beginning of the year. So all these materials and what the main tendency we saw that we can divide messages, divide the material according to understand people and their relationship with the world. And we outlined three types of frames, according to Ken Wilber integral theory. So on this slide, I will go from the bottom. So first types of frames is personal. How it means how personal. No, yeah, personal. How somebody can describe their condition and it how we understood it from posts. People share about their condition, their state, how they feel, how they understand themselves in this themselves only about themselves. It was like a signal that I'm changing. I need support. It's like a voice for help. Interpersonal frames were mostly about talking to another. When people understand that people believe and somebody believes that there is another person who experienced the war in such a way as he or she, or he want to share their experience of preventing like panic attacks or other vulnerable situation. And this interpersonal level, interpersonal frames, it's about trying to help others. And general frame, it's contextual frame or historical frame, how people understand themselves according to the war. So in such messages, we saw connection. So they mentioned war in this message, not just talking about themselves, but mentioned the war. So that mentions that these changes is according to the war. Let's go to more detail. So first, general frames of representation of psychological states in the discourse of war. The key frame was we can outline like that the war event that destroys life irrevocably. It is most evident in the topic no understanding of what to do next. Life during the war is scary, difficult, and hard, and otherwise life goes on. So it is the war, but life goes on. So we had like pessimistic and optimistic approach to understanding themselves in the war. Some people say the war is engraved on our face. I'm not talking about 15 plus for one trip to Bakhmut or Solidar. Some cities were totally destroyed during the war. But it is interesting how people understand their aggressiveness. It would be next. But here we see that people talk about changes in their states, but these changes they connect to the war. They say that these changes due to the war. Interpersonal, it is about not about relationship between person and world around him. It is the relationship between other people that have such an experience or could help, or people with whom you can share their experience. There's like activation of communication to be with others. So this level we can, for this level frame, we can outline frame like active resistance. So people activate each other with sharing of their emotions, their advices how to deal in this situation when you feel not good, and you feel that your mental health is not good. So there was a lot of advice, description of methods from different actors. Numerous thanks to the psychologists to show that psychology is helping people. It was like an advice as well. Stories of the specialists themselves about children and elderly coming to them. So they opened the space of understanding how it works, how psychological help works. It is a very interesting moment. So psychology of mental health became go to public. People start to discuss it, to share it trustfully, to share it sincere. So it is phenomena, I would say, because it is some people not allowed to share their psychological states in normal life. But in the war, they mobilized, and this mobilization were on public, and they discuss it, they reflect this experience. Yeah. And personal frames, we goes to the how people understand themselves, how they observate their stage, and the key meaning to this level is the frame of fixing the change. So they talk about the changes, like I want to document this situation. So I feel pain, I document it in social media. I feel I want to eat. I want to eat something strange, and I want to fix it. So it is on personal level. People just made a diary what I do in such cases, and this stage linked uh, and connected to the general frame of war that irrevocably changes, destroys life. So they want to fix these changes, and they fix this personal changes in word in practice. They and another connection with another frame is with this frame of resistance, active resistance. So they it is something that they do less to be active. They put this documentation to the social media to show how how this person feels. There's less he can do, but it helps. And very interesting thing that how people understand their anger. Um, because it is anger that activate resistance. Anger is the only thing that has kept me alive these days. Anger as a marker of stress habits, shelling, drones, alarms, threats. It is very difficult to remain in normal state in the face of all of it. So there's less and less fear and more anger. So it is about how people construct their resistance and how they understand itself in connection to itself, to other people, and to the world. So some conclusions, what we defined. Ukrainian social media users are capable of self-organization and information resistance to the aggressors, and demonstrates people's desire to restore themselves and rebuild the country that has become a war zone. It's like a revival. Mental health discourse in social media was organically developed and structured through frames of shared experience. The discourse was framed on three levels, as I said, general, interpersonal, and personal. The experience of war developed the general frame. War is an event that changed life irrevocably, which was combined with frame of other levels, interpersonal active resistance and personal fixing changes. The discussion developed intensively and acquired signs of collective intelligence capable of self-learning through dissemination and production of means of countering threats born of the context. The situation of Ukrainians is extremely dependent on the overall situation at the front line. Moreover, when journalists talk about psychological conditions, they do not always refer to expert opinions and disseminate unverified information in this regard. And this does not contribute to increasing societal resistance to confrontation in situation of vulnerability. I should say that now things changes, and mainstream media use this experience of first year building resistance. Social media, because social media in that time play a role as a platform that balances the influence of mainstream media and ensures the freedom of thought and access to information. So what people don't have, they can find it in social media. It cannot be overestimated. However, despite the rather optimistic results of using social media to increase the resistance to military aggression, the analysis also reveals challenges related to the specific of media use, logic of media use, personalization and high quality storytelling tools that help to make the communication of psychological assistance resonate can help to popularize the other topics such as evidence-based medicine, diagnostic accuracy. However, some professional abuses, sometimes due to ignorance of media effects, and sometimes out of a desire for personal gain or recognition. During the first year of the war, the Ukrainian society went through 3 periods of awareness of psychological states, from confusion about the situation of vulnerability that a person can influence, to find a solution or to overcome problems and regulate the personal state, and then to establish an interpersonal communication for mutual assistance and understanding the war in the context of shared social values. People became stronger because they start to communicate, to share their experience and to communicate to each other, and then they started to build new knowledge together. Through communication on social networks, the representation of experience and unification of their own people, collective resistance to a situation of vulnerability is formed. So yeah, here is one first year of scaled invasion, how people reflected their mental health issues in the social media. And if there would be some question, I would be happy. So there is some contacts. I'm grateful for the attention. Thank you.